If you are in pain today and it's keeping you up at night, you should go to the dentist today. If you haven't been in pain for the last 6 months of your life and you haven't had sensitivity in any capacity in your mouth, you only really need to go to the dentist once a year, right? My name is Dr. Turab Rai. I'm from Franklin Dental Care and Dentures. I'm here to tell you, you know yourself better than your doctor does in a lot of ways, right? But your doctor knows the science of the things that's going on. So what is the divide between, hey, I know who I am, I know what I eat, I know how shitty I am, and a doctor telling you, hey, you're actually doing great on these things. If you just took a look at this, you'll have the results that you're looking for, right? At the end of the day, checking up and going to the doctor is a necessity because they have the science, they have the skills, they understand. If you hopefully don't perceive every doctor just trying to gyp you for money and trying to take all the stuff from you and give you all the fillings in the world and do all this stuff, you realize that there are good doctors out there that are just genuinely committed to your well-being. And that means that they can give you context on life outside of even health, right? Doctors that are like myself, that are doing a lot of these other things, we can give you context about mental health. Fine, I'm a dentist, sure, but dude, dentistry is hard, right? Or I can give you context about business stuff or finance stuff, or I can give you access to resources and networks. So it's like, it really comes down to not necessarily how often you have to go to the doctor, but hopefully you like your doctor enough to where you just kind of want to go to them every now and then to check in and find the scientific evidence that's required to know what's actually going on. So the other thing is, in general, cleanings, if you're watching this video, I want you to lick your teeth. Okay? You gotta lick your teeth and lick right behind the front lower teeth. Okay? If they're not silky smooth and you have some sort of buildup there, you should go to the dentist. They can clean all that stuff up for you. And usually where that happens is when we don't brush our teeth for a couple of days and then we're like, it'll be fine. Then we don't brush our teeth for a couple of days and we're like, it'll be fine. And then we don't brush our teeth for a couple of days and it's, it'll be fine. You get this buildup. It's called calculus. You can't remove that, man. You're screwed. You need the dentist. So that's kind of those scenarios where it's like, okay, am I gonna deal with this or am I just gonna go in and do what needs to be done, right? So that yourself. And at the end of the day, we're one of the few dentists that can see you within 2 weeks here in Ohio. So come on down. Medicaid's reimbursement rate has increased a tremendous amount. They're approving a lot more procedures. So if now is the time that you're watching this video, I'm telling you, come down. I'm not gonna hurt you, okay? I'm gonna tell you what you need to know, and I'm gonna be very kind to you, and I'm not gonna force you to do a damn thing, okay? Enjoy your life, enjoy who you are, let me help you. The other thing is, in general, if you are in a situation where you have pain, if you are in a situation where something's waking you up at night, that tooth's gotta come out, or that tooth needs a root canal, right? Root canal teeth in general, do they need crowns? Yes. Yes, they need crowns to stay stable. Is every tooth that is infected root canalable? No. No. Some of them are broken down too much and then you have to go to the extraction, right? But how are you gonna know that without coming to the dentist, without getting an x-ray taken, without us actually looking at the thing in your mouth? How are you gonna know that, right? How are you gonna resolve that problem that is genuinely making your life a living hell? Right? Tooth pain is worse than giving birth, from my understanding, from basically every single female that I've ever treated. So don't get to that point. That's the prevention part of things. That's what Bright Smiles Community Outreach Coalition, that's what we teach our patients. The prevention part of it is, listen, I don't care what you eat. I care how often you're eating. If you're snacking, cavities. If you're snacking, you're about to get cavities, okay? Do not snack all the time. Try to eat major meals. Have 4-hour chunks in between where you're just chilling, drinking some water, socializing, hopefully doing some work. Go and have another major meal, do the same thing. If you're gonna drink an energy drink, drink it in like 15 seconds, dude. Just burn your entire throat. No, I'm kidding. But just drink it really fast, right? As fast as you can, and then take a chug of water, right? If you don't want stains on your teeth, if you're someone that's like a model, you're like super, you wanna be aesthetic, if you're a vain person, come on down too, we can help you with that, right? We got crowns, we do these beautiful cleanings, we have whitening, right? There's a lot of these different options. So it's like, how often do you go to the dentist? I don't know, what are your priorities? What are your priorities, right? Do you wanna be like excellent? Do you want like blazing white teeth that shine in people's faces and they're like, how'd you do that, man? Or do you want, just a healthy mouth, right? That is going to determine how often you go to the dentist. Also, are you in pain right now, or have you not been in pain for the last 6 months? That's going to determine whether or not you want to go to the dentist. But at the end of the day, dentists are friends. What was that Finding Nemo quote? Fish are friends, not food.
Fish are friends, not food.
Yes. Does that apply to dentistry? I don't know. But anyway, my name is Dr. Turab Rai from Franklin Dental Care and Dentures. Hopefully this information finds you well, and I'll see you here. Also, subscribe. Take care.